Hello, my name is Vaikunthan Rajaratnam. I'm a hand surgeon working in Singapore. In this lecture today, we're going to look at the role of robotics in rehabilitation. We're going to look at the biophysical impact of various conditions on the neuromuscular system and how it affects function. And we're going to look at how rehabilitation works in both orthopedic and neurological condition, and how robotics have evolved over the last couple of decades to impact rehabilitation. I have no financial conflicts. I'd like to just say that these views that I expressed today are mine and mine alone, and my views may change with the change in evidence. To be able to understand the principles involved in rehabilitation, it is good to be able to look at an individual from the perspective of the biophysical impact of the condition on that person. So in orthopedics, we generally see fractures and illness of the joints producing movement disorders as a result of stiffness and pain associated with this. And the resultant stiffness can affect function. In neurological situations where the nerve to the muscles are affected, then we need to look at how we can improve the function through various intervention, taking into consideration the neural plasticity and the cortical reorganization that can occur in the brain. So when you look at rehabilitation, there's a significant difference between orthopedic rehabilitation and neural rehabilitation. So what are the outcomes that we are looking for, the functional outcomes in neural rehabilitation? Because you want to get cortical reorganization as a result of the injury, and so as to get motor function with the mobilization of the limb, and taking into consideration that neural plasticity can occur due to the formation of new synapses. So cognitive task assignments are useful in the rehabilitation. In orthopedic rehabilitation, we're just looking at functional range of movements and to increase muscle strength so as to facilitate recovery. Pain reduction is an important component, and also the prevention of stiffness and rigidity in the joint through contractures through early movement. And so this is the basic difference between the two types of. So the broad principles for orthopedic rehabilitation is one of intensive practice in an isolated area, which is usually assisted by the therapist, which is quite intensive in terms of resource, and it's a combination of passive and active or passive assisted. So it's a progression from passive to active movements to increase the range of movement and increasing strength and loading of the joint to ensure optimal return to functions. So what are robots? Robots are generally devices that assist with movement by converting energy into mechanical force. And usually it could be electrical energy with the use of an electrical motor, sometimes assisted and augmented with hydraulics to provide movement. And in terms for rehabilitation, robotics are also able to get feedback from sensors within the mechanism and to record performance. Robotics is not new in medicine. In 1910, Theodore Budegen patented a concept for movement cure apparatus, which is using electric motor to guide and support stepping movement in patients with cardiac disease. And Richard Sherrup used the meridian, which is a cable-driven apparatus to move joint, usually powered by the patient himself, is a human-powered device for assistive movement. And you may not realize that CPM, the continuous passive motion, was the first robotic system to be used in orthopedics, especially to encourage movements in a joint with the use of a device. So what is a therapy robot? So therapy robot is a device that is reprogrammable, and it's got multiple functions that are designed to perform different tasks, usually motor tasks, through various program motion. So grasping, gripping, these are the tasks that a therapy robot would help assist and by repetition provide intervention. It can be distal based or proximal based. So the various types of device can be either driven by motor with passive mobilization, or it can be active and assisted exercise where it can detect the amount of movement to augment or to provide resistance to increase motor power, and through sensors it can provide feedback to the patient and to the therapist in terms of the performance of the task. In this video, you can see the use of an exoskeleton, which is a robotic device in a paraplegic. So these are the various phases. It's not a magic that you can just wear it and walk. It requires a lot of intervention by the therapist, a lot of training. And here you can see that this device is controlled by the smartwatch to get certain actions going to standing up. So there is actuators which are motors within the system to help with his movement of the paralyzed limb. So this is purely assistive, and it is gets feedback from the patient through his device, and it allows for mobility in a paralyzed individual. So this is a wearable exoskeleton, which we will later look at the various types of robots for rehabilitation. Duret and co-workers in the systematic review on the use of robotic neuromuscular rehabilitation looked at the various studies and showed that basically in neuromuscular rehabilitation, robots have quite a role to play. And for effective technique, they can have three roles that they play. They can do in the priming phase, and then they can augment the therapy and also aid in task specific practices. So it is a device that helps to translate the intensity of the treatment program. This was mainly for stroke and upper motor neuron lesions. And they also found that the effectiveness was depending on the type of assistance that it provided. And it also was able to alter the various conditions to provide the therapy. And it allowed for very objective and structured evaluation of the performance of the task through the machine that is reproducible. And it was a great enabler for the rehabilitation process. So it doesn't negate the role of the therapist, but it enables the therapist, and the robotics are quite a useful tool, as has been shown in this systematic. So if you look at the rehabilitation cycle, the rehabilitation cycle basically involves an assessment of the patient to identify the patient's problems and needs, and from that to then through a decision process to generate various intervention plans, and together with the patient to agree on certain goals to achieve, and then to evaluate whether the goals have achieved, and then to go in a cycle. The role of robotic rehabilitation can be both in the area of assessment and in the area of decision support system to provide the specific intervention. And these two areas can be automated to the use of robots. And this is the future of robotic rehabilitation. In the assessment field, it can, with the aid of the therapist, help in getting the input from the data from the patient in terms of evaluation of his motor function, range of movement, and through which to record it, both for the purposes of initial assessment, for intervention planning, and also to record progress and trends for both assessing the effectiveness of the intervention and for motivation for the patient to realize the gains in improvement from the therapy. So you could see that it also can help with the decision support system to plan the intervention based on the evaluations obtained through the robot. And so this diagram explains how especially in neurorehabilitation, robotics have a significant component to help automate the process. So, in detail, the functional assessment and evaluation of the individual can be assisted by the robot through the evaluation of the motor and sensory function to a certain extent. It can assess function in terms of activities of daily living or work or recreation. It provides a rapid and valuable tool to assess, which is consistent, and some of them are wearable devices which can therefore evaluate the performance of specific motor tasks in the environment, and this data can be used for a functional assessment of the individual, and that's how the robotics can be useful. So the robotics are not just for the purposes of intervention in providing rehabilitation, but for assessment and evaluation can be quite useful, especially in the upper limb. The use of wearable gloves can be useful to assess the function. In the treatment program, it can help with assisting with the movement. It can provide re-education, especially in sensory loss, with the use of the acoustic glove. It's a bionic acoustic glove to help with sensory re-education, while neural plasticity occurs in the brain due to with the process of recovery. Neural prosthesis is another new area which provides biofeedback, and the future, especially in work-based assessment, will be the use of robotics in real-world assessment of the patient functioning within his work environment. So how can therapy robots be used in the clinical environment, especially in the upper limb, the end organ, which is basically the hand? The whole function of the upper limb is to put the hand in the appropriate position to perform a motor task. So the grasping movement is the end effect that we are looking for, and the robots can help in placing the limb for that position. And it also allows for targeted finger extension, because one of the problems, especially in stroke with increase in spasticity, is the inability to extend the fingers, and the robots can help to extend the finger to open the grasp so as to provide proper grip. Biofeedback is another area, as the feedback from the movements and the use of surface electromyography with the contraction of the muscles, the robot can then use that feedback to assist the movement to provide the ultimate goal of the end effect of the motor task. The other aspect is in providing stimulation to the brain, because as the patient sees function occurring in a otherwise non-functioning limb, with the aid of the robot, it helps and motivates the patient to continue with the therapy for recovery to occur. And the use of vibration and continuous passive movement has also been seen useful in the reduction of spasticity, especially in stroke patients. One of the basic principles of rehabilitation, especially for the muscular system, is a task-oriented rehabilitation. The whole purpose of the movement of that limb is to conduct a particular motor task, and so therefore if that is incorporated into the rehabilitation program, it brings better outcome, especially in terms of activities of daily living. The use of sensor-based digital surfaces as part of the robotic platform helps to achieve this. So you can put various types of object, real-world articles on the robot surface and get the patients to be using the limb to achieve the motor task. And this helps with gross and fine motor skills, with hand-eye coordination, motor coordination, and also fine motor skills. The use of the robots can also optimize rehabilitation through a process of neurological rehabilitation using both the sensory components within the robotic system and the robotics actuators to help with the movement of that limb. The major part of the robot in this task is to act, especially in those with low motor activity due to paralysis, is to remove gravity by lifting the up limb and then using the end organ to achieve the motor task. So what are the types of robotic devices? So robotic devices can be active, interactive, or passive. So in terms of the end effector robots are devices in the periphery. For example, in the upper limb is for the hand to be able to achieve something. So the hand needs to push a bar or a switch or a gear. Then the arm and the forearm need to be placed in that position for the end organ, which is the hand, to perform the task. So that's an end effector robotic device. An exoskeleton acts directly upon a specific joint. It is assisting the joint to move based on a need basis, and it eliminates the effect of gravity to allow for smooth movement of that particular joint. The other type of a robotic device would be to assess performance. So what it does is to measure the movements very precisely and the smoothness of the movement, the range of movement, and interlimb coordination. And so this is for the evaluation of the function, and it's an objective evaluator. The fourth type of robotic device is the robot-assisted telerehabilitation. We'll come a little bit more in detail later. This is consistent, reliable, and automatic assessment of the motor function, free of subjective bias of the therapist. And this is moving forwards for community-based rehabilitation with the use of remote devices. It can become and will become a useful platform for rehabilitation in the community. Generally, robots can be classified into three types: grounded exoskeleton, grounded end effector, and wearable exoskeleton. So we looked at some of the example earlier on, so in the upper limb and in the lower limb. So the grounded exoskeleton is just basically getting movements through the use of anti-gravity device that's attached to the limb to bring about an end effect. For the end effector type, it's again grounded on a machine, and it brings about the effect of the hand performing a particular task. These are all well established, and what is coming out now and becoming established is the wearable exoskeleton. So we have that in the upper limb and in the lower limb, as you have seen earlier in the exoskeleton for the lower motor neuron in paraplegics. So again, how the use of the robotic device in activities of daily living. It requires, you must understand that to perform a particular motor task, there is the ideation and creation of that task in the mind at first with the firing of neurons. And in a paralyzed situation, we assist that through the use of the robotic device to provide anti-gravity to put the hand in a particular position. So the use of manual and bimanual controls to bring about a particular motor task is useful. We are moving towards brain electrical interface, the use of commands from the brain to move robotics to help in the movement. And that's the future of robotics in neurological. Similarly, in the lower limb, from a grounded to a wearable device, these are becoming more and more popular with the advancement in materials and miniaturized actuators. It is possible now to be able to commercially have these products and to be used in the community with minimal therapy supervision to be able to obtain mobility with the use of these exoskeletons. One of the great advantages of robotics is to enable the use of community-based rehabilitation. The availability of devices that allows the individuals to be in an intervention program that's customized to them. At the same time, recording performance objectively and tracking the performance with intermittent support and assessment remotely by the therapist, and therefore becoming more efficient. And this will be the future of community-based rehabilitation, as otherwise institutional-based rehabilitation is expensive and it becomes difficult. The rapid rehabilitative process while in the community also has been shown to be effective. So in this slide, you can see the difference between an upper motor neuron and a lower motor neuron lesion, as in a stroke or as in paralysis from brachial plexus or spinal cord, and what are the goals are. So the goals and the rehabilitation approach towards this goal, and what are the technology that can be utilized to achieve that goal. So for example, in a stroke patient, the goal is to get the proximal muscles to be activated and to prevent contracture formation, and to use the impaired limb for support and holding functions which are more gross function. And the approach would be one of muscle strengthening and stretching to avoid contractures, the role of passive limb motion to prevent contractures, and compensatory strategies. So here technology can be used. You can use a passive device that can be used at home to keep stretching the muscles so as to prevent contracture, help them to, with the use of a wearable exoskeleton, to put the hand in the proper position with appropriate movements in the shoulder and elbow so that they can then use for assisted living with the condition that they have. So here we see examples of robot therapy in practice for motion assessment, for force assessment. It also can be used for spasticity assessment and with help with the Ferguson assessment. You can also, as we mentioned earlier, the use in CPM as a continuous passive movement device. It has got great sensitivity in testing and in training. And the use of virtual reality to augment the motivation, which is an important component in rehabilitation, the use of gaming, and surface electromyography as a biofeedback has also been now incorporated into most robotic devices. So for a robot to be usable, what's the usability? The important things as far as therapy is concerned, the setup time must be short. It must be easy to set it up. There's an opportunity for group therapy, so it allows for various mix of patients. It should be accessible, easily accessible to the patient. There must be objective assessment that is available on the system, and it must provide enough motivation through virtual reality, gamification to enhance the engagement of the individual, and it must provide automated reporting that can be used for evaluation and trend improvement, and it must be able to provide easy training for staff. Some of the studies have shown one of the great drawbacks is the expense of these devices. However, with improving technology and the use of a subscription as a service model for payment, it is possible to reduce the cost and make it more accessible. They are clinically effective and they are efficient. There's various studies that have shown there's improvement in various objective evaluation in various conditions. The Barthel index and the Ferguson scores have improved, and they allow for efficiency in the sense that one therapist can attend to more patients because a robot will take over the automated function and leaving the therapist for more bespoke activities. So what are the effects of robot-assisted therapy. And in the upper limb stroke, systematic review showed that there were significant but small improvements. And I think these small improvements cannot be just said it's small because we use instruments that are very generic, like the Fugger-Mayo scores are not really perfect. So even though if you look at the Fugger-Mayo assessment of a patient, say post-neurectomy in a stroke, it may be a minor improvement, but for the patient, when you ask him how effective it was, it is significant because reduction in the spasticity improves overall function in the upper limb. So qualitative tools need to be used to evaluate the effectiveness of some of these robotic devices. The basic ADL changes were found to be not much, especially in stroke and especially in the proximal areas, but it allowed for increased number of the repetition and intensity of practice with the use of the robots. The availability of these robotic devices who are able to monitor performance through an assessment system to the sensors within the device, plus to provide training and repetition to ensure that the patient adheres to a treatment program, allows for unsupervised home-based rehabilitation, the foundation of telerehabilitation in the community. And I think this is the way forwards for rehabilitation in chronic disease. The other area is the use of wearable devices and systems to monitor patient. And this moving forwards, the use of accelerometers in wearable devices like your activity trackers can be incorporated with the system, the robotic system, to ensure monitoring and specific interventions and trends in the patient's journey towards optimization of function. Just a quick word on anti-tremor devices. These are robotic devices that can be worn on the hand, especially for those with conditions of uncontrolled movements, like in Parkinson's, and they have been the use of various motors within the system helps reduce tremors, and they are quite useful. So some of the challenges of robot-assisted rehabilitation is the commercial availability of products. Cost coming down. The other thing is the direct supervision from a therapist. Telerehabilitation allows for some of this to be done remotely. The patient adhering to prescribed regimes is difficult. The motivations needs to be high, and the use of virtual reality and gamification can help. So what's the future of robotic rehabilitation? I think with the advances in materials, lightweight devices, and the availability of off-the-shelf devices, the incorporation of motivational elements such as gaming, virtual reality, and educational and scientific tasks within the intervention would help. The use of both motor and cognitive exercises within the rehabilitation regime will be useful, especially I think the use of motor imagery and mental practice in addition to rehabilitation. It also empowers the therapist to provide rehabilitation more efficiently and empowers patients to have greater access to rehabilitation with telerehabilitation. And robot-assisted home-based telerehabilitation will be the future. Thank you.